Here at Self, we're all paying attention to the buzz around psychedelics, which are being celebrated as a promising treatment for several mental health conditions like depression, PTSD, anxiety, and even addiction. We wanted to know, how do psychedelics actually work? And what does the future look like when it comes to making these medicines accessible to all?
Psychedelics have a lot of promise and a lot of potential. A psychedelic experience can really help support someone in really engaging the core challenge or the core issue, especially those with mental health challenges. Going to the root of the problem is often the most efficient and effective way to heal. I'm Joseph McCowan, a licensed clinical psychologist and psychedelic therapist.
I find the term hallucinogenic to be challenging because the state that I have of myself as a queer brown man in America and being fully accepting of myself, that is not a hallucination. The collective bad trip that we are all on is homophobia, is racism, is misogyny, is the systems and the places that we live in that reinforce those. I'm Dr. Jishan Chowdhury, and I am the CEO and founder of Journey CoLab. I never thought I'd be running a psychedelic drug company for two main reasons. One, I'm a product of the 80s, and even in Canada where I grew up, the DARE program and the propaganda was strong. And so I grew up seeing the egg being fried on a frying pan and thinking that these substances would fry my brain.
This is drugs. This is your brain on drugs. Any questions?
I'm also from a traditional Muslim family where even today we don't have alcohol in our home. And so I didn't grow up with any relationship to these substances or what I call now medicines. So I was one of these really nerdy kids growing up. I wrote my first peer-reviewed paper at the age of 16, got into med school early at the age of 19. And so my job as a first-year medical student was to pull the chart off the wall, go into the room, take what we call a history of a patient, which is basically just an interview, and rinse and repeat. This one day, I pulled the chart off the wall and I just stopped. And back in those days, the mental health questionnaire were these pink pages at the back of the chart. I flipped to the back and I, for the first time, answered those questions honestly to myself. And by the time I got to the end of the forms, that was the first time I realized that I was living these two very parallel lives where on the outside, my life looked great. But on the inside, it always just felt like, it's hard to describe depression and anxiety, but it always just felt like I was drowning in my mental health. I tried the best things we had available. I cycled through different antidepressants. I tried all sorts of therapists, coaches, workshops, and it was never like these things didn't work. It always just felt like someone threw me a life preserver and I could keep my head above water. It got to a place in my life where I'd be walking around the streets of San Francisco and I would think to myself, hey, maybe it would be better if one of these Uber drivers just hit me. I wish I could tell you that I came to psychedelics because I was enlightened or because I was ahead of the curve, but I was quite frankly just desperate for something that would work. Fortunately, because I live in San Francisco, I was able to meet a real therapist, so an LMFT, someone who had done additional training in psychedelic medicine. And back then, I didn't know that this was going to be that important, but they had spent time with indigenous communities about how they've used these medicines for thousands of years, because even though they may seem new to us, they are in absolutely no way new to humanity, and we have had a long relationship with them.
They've been used by Native and indigenous cultures across the globe for millennia. We do know that there was a lot of tradition and ceremony and structure and ways in which folks use these medicines in community toward healing, connection, rites of passage, togetherness. In essence, this is just like a rediscovery of what many indigenous communities and cultures already knew.
My name is Rachel Yehuda, and I'm the director for the Center for Psychedelic Psychotherapy and Trauma Research at the Icahn School of Medicine at Mount Sinai. One of the most common reasons that people seek therapy is for the feeling that they're part of a cultural history that they haven't fully been able to process. So one of our thoughts has been to see whether psychedelic-assisted psychotherapy can help people process some of their early memories of when they began to understand who they were in the world in relation to their unique history. Because a lot of people do walk around holding a lot of feelings that are not just based on their own experiences, but are based on experiences of a larger family and a larger culture and a larger community.
The way I like to describe my first experience with psychedelic therapy was like these muddy waters that I had been drowning in my whole life. They cleared up for a moment, and I could see the weights that were holding me down. And this is what it actually felt like. And in that visionary psychedelic state of consciousness, I could, for the first time, see how my parents going through a civil war in Bangladesh and then coming to a new country, just how that whole arc of intergenerational trauma affected our entire family. Before, it was just like this concept that I had heard about in medical school or read about in journals, but I actually saw it and felt it for the first time. And what I'm so grateful for psychedelic medicines and therapies is that it lets us get beyond that surface level into what really lies underneath and what's really driving our mental health.
Often many refer to it as peeling back the layers or a deconditioning process toward getting to that core. And once there, that's really where powerful work can be done.
And so that started for me a 2-year journey, talking to almost 300 people in the psychedelic space, from therapists to medicine elders to scientists and researchers. I just kept coming back to like more people need to be able to have access to this, and they need to have access to it in a safe way. And so decided to found Journey. And what we do is important in terms of translating the known potential of psychedelics, both from Western science as well as traditional knowledge, to the treatment of addiction.
Interestingly, psychedelics were looked at back in the 1950s and 60s. LSD was looked at with regards to reducing alcoholism. Psilocybin was looked at for smoking cessation. More recently, there's been an emergence of both of those being considered again. And so with those two, you really have folks who are embracing and going back and doing reviews of the research from decades ago. With Ibogaine, you're seeing a lot of promise with regards to opiate addiction. And we know that's a huge problem right now.
So at Journey, we are creating a synthetic version of mescaline, which is a natural occurring psychedelic found in the peyote cactus, found in the wachuma cactus. We're creating a synthetic version of that because we are in consultation with indigenous communities who have told us that, one, these plants are endangered, and two, that they want their rights to their sacraments and to their religious freedom to be protected for that. And taking mescaline through the FDA, through clinical trials, in a combination of therapy and community for the treatment of alcohol use disorder. Psychedelics are not a silver bullet. They do not work alone, but they are a very powerful tool. What psychedelics seem to do is open up this window of change in the human brain. You can almost think about someone suffering from mental health or from an addiction having a very rigid brain where patterns of behavior or patterns of thought are essentially have been locked in. And this is very much the case in addiction.
Some of the main ones being looked at and studied right now are psilocybin, MDMA, ketamine, and there's some renewed interest in LSD, although many of those studies have yet to begin. They all work differently and might activate like different areas of the brain as well as work with different receptors. But even outside of the chemical elements, there's often a process in which one is connecting just more deeply with themselves in the present moment. It helps create like shifts in ways of perceiving and being in that moment, which then can unfold into ways of relating with others, self, and the world.
There's this almond-sized part of the brain called the amygdala that psychedelics, particularly like mescaline, work on to reduce the fear response so that these traumas that we have faced, it's easier for us to then process and release rather than being stuck in traumatic loops.
MDMA shows a lot of promise when we're looking at trauma. It's the furthest along in phase 3, looking at PTSD.
MDMA promotes a feeling of self-compassion and introspection, and it also promotes a kind of interpersonal trust with the therapist. MDMA also reduces fear of traumatic memories. So all of these things together put the patient in an ideal state, I would say, for processing their traumatic memory. They don't necessarily feel they need to retreat from the memory, and they also don't have this whole chorus of self-blame and shame and guilt that often comes with talking about traumatic material. It really provides an environment for somebody to begin to process a traumatic memory.
People have done psychedelics in different settings, but psychedelic therapy in a clinical setting is a very different experience. It's less like going to the beach and more like climbing a mountain that you're not sure you're going to be able to get up to. There will be some very steep climbs. There might be some scary cliffs. At some point, you're going to want to turn back and you won't be able to. And there may be even a storm. But once you get to the top, the view is worth it. To be able to see yourself, your psyche, how you fit into this world is absolutely life-changing. The way we like to think about psychedelics for mental health is more like surgery for the mind, where just like in surgery, you have a highly trained operator or operating team. It's in the equivalent of a set and setting that's highly regulated, like an operating room. There is a risk. You are putting yourself into a vulnerable situation, just like in surgery. The patient or person will prepare with a therapist. Then during the actual, what we call dosing session or journey, they are in a safe place. They're with that psychedelic operating teams. And then afterwards, just like after you're done from a surgery, there's post-acute care to make sure you're safe to get home. And then there's rehab afterwards. And just like the right surgery for the right patient, we see incredible effects with psychedelic medicine that people who have had debilitating disease can get a lot of their functional life back and their lives are changed or different from what they were before.
What all of the therapies have in common is, really careful preparation, support during the experience, as well as integration following the experience. And all of that combines towards a very powerful healing process.
These medicines work, as they always have, with therapy, with community, with the supports around them. And that's an exciting opportunity for us to create what we call this healing economy, where it's not just about making or taking a pill, it's about local centers with local operators that look like the people that they're trying to serve, and that the value that's created is shared amongst them. And I think that's a vibrant healing economy of jobs you can't outsource and jobs you can't automate, where we're spending our time and energy on healing each other, but we're giving ourselves better tools to be able to do that.
Psychedelics have a long, rich history, and part of that history is the legacy of harms and mass incarceration. The war on drugs and colonization landed heavily, if not mostly, on people of color. So it makes sense that there remains a disconnect and an avoidance. There's still a lot of resistance toward considering these medicines, especially in the context that they're being used right now. Individuals from marginalized communities experience higher rates of trauma and depression, but are the least likely to engage with these treatments. The therapy spaces are often spaces where folks of color haven't really been able to be vulnerable. Entering a space, especially a psychedelic space, and surrendering to an experience, it's a giant leap to take for people who haven't been able to let their guard down for centuries. There's a lot of work to be done towards, helping support folks who aren't currently accessing these treatments in accessing them. These are often those who need healing the most.
These medicines are our natural right, are our human right, and they've been taken away from us. And it's only because of communities of color, and particularly Indigenous communities, who held on and fought back to keep these, that we are aware of this. And all of the science that comes from this modern science around psychedelics comes from those communities. So you cannot tell the story of psychedelics if you do not talk about the story of brown and black people, and if you don't talk about the story of women as well. This was largely a tradition and technology kept and stewarded by women. And it's part of the society that we have, the patriarchy and the misogyny, that this was taken away from us. We need to bring it back in a way that is inclusive of these groups.
We really have to make sure that we're including a diverse representative group of people, both as research participants and as people that are doing the research, because otherwise this will not be a therapy that will necessarily generalize to all of the people that can benefit from it.
When I was young, my dad, who's from the South, he would take us camping, but we were often always the only Black people camping. And when I was like 10 or so, I asked my dad, I was like, why is that the case? Like, why are we always the only Black people camping here? And he shared, where my family's from, in the South, Black people don't go camping. They just don't go to the woods. You'd end up harmed or, harassed or lynched. The tree represents something very dangerous. For many people, safety is in staying where you are. My dad mentioned how difficult it was for him. He engaged those spaces with a lot of fear, but also recognized that they were powerfully healing spaces as well. And so sometimes what we perceive as harmful is often what can be healing. And the same is true when it comes to psychedelics. There's freedom in that exploration.
For some people, the psychedelic-assisted psychotherapy closes the loop on something, and then they're done. And for other people, it opens up a process, and they're by no means done. And so we're going to have to be able to figure out as we go who's really done and who we want to keep talking to. And that's going to be the challenge in the future when we integrate these psychedelic tools into our clinical practices.
The work that needs to be done, it's the work of all of us from any position that we hold. Psychedelics are powerful medicines, but we're also each other's medicine. It's not about just embracing psychedelics and their potential for healing, but also embracing equity, our connectedness. The healing of all of us is really the only pathway towards healing.
It is our right as human beings to have access to these natural occurring products and these natural occurring medicines. And by bringing them back, particularly in a way that is more inclusive and reciprocal, we can all live in a much better world than we live in now.